Hello, everybody, and welcome to the third episode of the Empowered Psychology Podcast. My name is Christella, and I am the host and the founder of Empowered Psychology, which is an educational platform and community that gives a voice to those with visible and invisible illnesses with the goal of empowering others to take control of their minds in order to overcome adversity and create their dream lives. Today's episode is part 3 of my lupus survivor story, and with me to educate us about lupus and my diagnosis is my amazing rheumatologist, Dr. Shalini Jha. So Dr. Jha is a rheumatologist and assistant professor at Baylor College of Medicine in Houston, Texas. She received her MD from the University of Alabama and went on to Strong Memorial Hospital in Rochester, New York. She did her residency training in internal medicine and pediatrics. She went on to do a rheumatology fellowship at Baylor College of Medicine. Therefore, she is a triple threat and is board certified in internal medicine, pediatrics, and rheumatology. So before we go on and talk about my diagnosis and lupus education, I just want to thank you, Dr. Jha, for just being an amazing doctor. I shouldn't have to thank any doctor for doing their job, but unfortunately, we have a very complex medical care system where some doctors seem to not care about their patients, but that has not been the case with you. You have been amazing, and you have put me in remission for the second time, and you are honestly one of the reasons why I am so passionate about educating people about lupus and other autoimmune diseases in general. So, before we get started, I just want to celebrate real quick with some ginger shots. Guys, you have to take care of yourself with lupus and without. And I really love ginger because it's an anti-inflammatory, and it has a lot of benefits that I can't get into right now because we have a lot to talk about. But other than being an anti-inflammatory, it just makes me really, really happy. So before we get started, we have to take our ginger shots. So yes, this is the brand Vibe Organic. Very amazing brand. I love it. You can get it at Whole Foods. And cheers to remission.
Cheers.
Woo! Okay, let's get started. So in the previous 2 episodes, I talked about how I got sick in Honduras. And honestly, as you know, this was really fast, I feel like. I would say I was getting sick for about a year, but everything really just sped up starting around October. From October to February, I mean, it was crazy. Mm-hmm. So I was hospitalized in Honduras, and my hemoglobin was very low, and they actually had to stabilize me before I got to Texas Children's. And I get to Texas Children's, and it took about, in total, 18 days to figure out what was happening. Yeah. And on my 17th birthday, February 18th of 2016, I was diagnosed with lupus. Before we get into the specifics, because today we have the facts. So in the previous 2 episodes, I went into kind of my personal story, but luckily today we have Dr. Jha, who can go into detail about all the crazy things that were happening in my body, basically. But before we get into that, I want to educate you guys about lupus with no one other than the expert herself. So, Dr. Jha, what is lupus?
Sure. So lupus is an autoimmune disease caused by chronic inflammation in the body. It happens for reasons that we don't completely understand. But basically, instead of your immune system fighting outside invaders like bacteria or viruses or parasites, your immune system kind of attacks itself. So it gets confused. It kind of finds particles in your body that are kind of breakdown products of your cells, kind of normal things that your body should just clear away. It creates these antibodies and attacks them. And so that leads to inflammation in the skin, in the joints, in the organs. So things like the kidney, the liver, the brain. the heart, the lungs, like all of these things can become inflamed, and it can cause a lot of problems. It can cause a lot of symptoms that are really uncomfortable, like fevers, weight loss. It can lead to damage to the organs if it's not treated. So basically, it's just this multi-system inflammation all over your body caused by your own immune system.
Okay, so now that we know what lupus is, what is the epidemiology of lupus? And for people who don't know what epidemiology means, can you please define that as well?
Sure. So epidemiology means like who does it affect? What are the causes? What are the kind of risk factors? Overall, just the kind of explanation of, the people who are affected and why. And so basically lupus affects women a lot more than men. So like if you had 10 people, 9 of the people would be women and 1 of them would be men who had lupus. So it's a lot less likely to meet a man with lupus than a woman with lupus. And we think that it mostly happens due to hormone reasons, but there's definitely a lot of genetics at play. There's certain environmental reasons it can happen. And it can happen to many different populations. We see it all over the world in different countries. A little bit more likely to happen in places with more UV light exposure. So southern hemisphere, southern states of the United States, those places are a little bit more affected. And then into more of the specifics, like they think maybe viruses can potentially trigger it. Like people with lupus who have newly been diagnosed have higher EBV virus DNA. They have like antibodies to EBV virus, and that's a common virus that a lot of people are exposed to when they're kids, but for whatever reason that virus kind of gets triggered again. So we think that might be playing a role, and then certain bacteria or your own gut microbiome may be causing that inflammation, because we have a whole immune system in our gut, and that may be playing a role. Sometimes things in the diet can lead to problems too. Other risk factors we think about are cigarette smoking, that's been implicated. People who have periods earlier in life, so girls who get their period at less than age 10 maybe have a higher risk of developing lupus. They've looked a little bit into birth control pills and hormone replacement that women take after menopause, and it seems like a slightly higher risk of developing lupus from those hormones, but it doesn't seem like those hormones cause a lupus flare if somebody already has lupus. But we wonder if the hormones are really playing a role, especially people who get pregnant. After pregnancy can be a time that lupus can flare up. During pregnancy can be a time that lupus flares up. Other things that have been implicated are like pesticides, silica, obesity. UV light definitely is a big trigger, so we tell all our lupus patients to always wear sunscreen, because that UV light can affect their DNA and cause inflammation in their body.
I know that in doing my research about lupus, it is associated with premature death. So my question to you is, one must be diagnosed with lupus and receive treatment, or it will result in death?
Yeah, I mean, lupus can be really scary. For some people, it can be pretty mild and cause skin rashes, joint pain, fatigue, and it may not lead to organ damage and death and those kind of serious complications. So some people do live with mild lupus, and it takes a long time for them to get diagnosed and get treated, and they may do okay, but they just have kind of poor quality of life. Other people, lupus can be really serious and life-threatening. So when it causes your blood counts to drop, when it causes your kidney to become inflamed, it can lead to the kidneys failing. And if the kidneys don't work, your body, can't handle that. And so you need things like dialysis, and, that can be really life-threatening. And same if there's a lot of fluid around the heart, a lot of fluid around the lungs, those can be really serious conditions. So yeah, there are times when lupus can be very severe to the point that it needs to be diagnosed and treated right away. Otherwise, it can lead to serious problems.
Can you describe the multifaceted nature of lupus?
Yeah, absolutely. So looking at what has been researched, up to 50% of patients can experience neurologic complications, which means like nerve problems like numbness or tingling, or inflammation of the brain, those kind of problems, headaches. 70% can have constitutional symptoms, things like fevers, night sweats, muscle aches or pains, fatigue, anorexia, meaning they just don't have an appetite at all, or weight loss, and they can have a lot of weight loss, like 10, 15, 20 pounds, sometimes more. anymore if it's gone untreated. Up to 70% can have skin manifestations. Some can have mucosal manifestations, meaning ulcers in the nose or mouth. 20% can have inflammation around the heart, which can develop something called pericarditis or pericardial effusions or fluid buildup around the space of the heart, which can lead to problems with the heart kind of not being able to kind of squeeze properly, and it can lead to chest pain and serious pain and shortness of breath. 40% can have pleural effusions, which is like fluid buildup on the bottom of the lungs, and that can lead to a lot of chest pain and shortness of breath as well. 30% can have kidney manifestations, so lupus nephritis, where you get inflammation of the cells in the kidney, and that can lead to urine protein and urine blood, and that can be a big problem because that can lead to the kidneys not working anymore. And in children who are diagnosed with lupus, the numbers can be even higher, like 50% of children who get lupus can get the kidney problem, so it's even more scary. 50% can have stomach issues, 50% can have blood problems, so low blood counts, low white blood cell counts, low platelets. 85% have arthritis or joint pain and joint swelling. 20% can have something called Raynaud's phenomenon, where their hands and feet turn like blue or purple when they get cold. That can even lead to little ulcers in the fingertips, and that can be quite painful in cold weather.
So now that we have a clear picture of how complex this disease is, and I'm sure for you, all your lupus patients they look different, right? I'm sure there's like
Definitely.
similarities, but I'm sure they all look different. So how hard is it to diagnose lupus?
So it can be a challenge because sometimes people have symptoms that slowly build up over time, and they go to their doctor doesn't quite know what's going on, they get the blood test, everything looks okay. So sometimes it takes a while for that primary care doctor to then refer them to a rheumatologist and for us to try to figure out what's going on. So that can be a barrier to getting a diagnosis. The other problem is certainly people manifest with different problems. So some people might have a skin rash, some people might have joint pain, some people might have kidney involvement from the beginning. So everybody looks a little different. So it definitely is a matter of putting all the pieces together, getting all the extra blood work, and putting all the information together. We don't have any exact diagnostic criteria. What we have are something called classification criteria, and they have updated those over the years, so that really helps us know which patients for sure have lupus. Classification criteria are developed for research purposes. So if we're doing a research project on lupus patients, we want to have a population that definitely has lupus, so that when we're studying them, we know that the treatments we're giving them should help or not help. And so as a result, not every lupus patient meets all of the classification criteria. Only the ones with the most severe lupus usually kind of fit every single checkbox there. So some people who are on the early stages of lupus, it can be a little bit harder for us to say for sure, because they may not have every single lab test abnormal or every single type of involvement of inflammation that can happen. So it can be a process, but as long as they're referred to us or we're called in the hospital to see those patients, we work hard to kind of get all the information and make sure we come up with the diagnosis.
Okay, so how important is timing in diagnosing?
Very important, because the sooner we can diagnose somebody with lupus, the soonest we can start treatment, and we can really help patients understand what they're going through, and what treatments will help them, and we can get the right specialists involved. So if they have heart problems or they have kidney problems, we can have those specialists help us manage the care as well. And if we don't treat lupus right away, that can lead to things like kidney damage, joint pain and swelling, problems like that can be really difficult to treat if left untreated for a long period of time. So really important that we get on top of things right away, so that we can minimize the chance of any long-term damage to the organs or long-term symptoms for patients.
Okay, so now that we have a clear understanding of what lupus is, now we're going to go into what happened to me on a scientific level from your perspective as a rheumatologist.
All right. So looking through all your records, it looks like around January of 2016, you were having a lot of problems with fevers, some joint aches. You lost a bunch of weight. You had some skin rashes. So went to a doctor. You were found to be very pale, and you had an episode where you had kind of passed out at school, and they found your hemoglobin to be very low. So your blood counts were really low. When you were seen at Texas Children's in early February, they mentioned you having like low-grade fevers, that weight loss. The skin rashes had gone at that point, but they saw that you had enlarged lymph nodes everywhere. And lymph nodes, their goal is to really clear out infections from your body, but when they're really swollen and in all sorts of different parts of your body, that's not normal. So that makes us worried about things like untreated infections or cancers, like lymphoma can lead to lymph nodes being swollen all over your body. And then rarely lupus can do that as well. And so when you went to the hospital the first time, they did a lymph node biopsy. So they took several lymph nodes from your neck area, looked at it under a microscope, made sure there was no infection, made sure there was no cancer. And there was no cancer, there was no infection, but your symptoms didn't really get better. So you came back to the hospital, and at that point your chest x-ray was looking worse. You had a little bit of changes on your chest x-ray, which they didn't really know what that was, and it was looking worse. So they treated you for pneumonia because you had a cough at that point. You were still having low-grade fevers. And then at that point, you still had the low blood counts. Your blood pressure was up a little bit. Your kidneys were looking a little bit abnormal on the blood work, and then the urine test was showing a lot of protein in the urine. Normal urine should have very little protein at all. Yours had like 3 grams of protein that you were spilling. So your kidneys were not able to kind of keep the protein in your body. It was just all going out in the urine. And that can lead to swelling everywhere, which I think you were having, swelling in your legs, your arms, those kind of things. And then basically from there, the other things they did, they made sure there were no infections in your blood. The infectious disease doctors were following along. The lung doctors were following along. They did like a bronchoscopy where they went inside with a camera and took a look because you were having some blood in your cough.
Yeah.
And that was really worrisome for, could there be inflammation there? Could there be like bleeding inside the lungs due to an immune system problem? You also were having really bad nosebleeds. And so the ear, nose, and throat doctors went inside with a camera. They took a look and tried to figure out why you were having inflammation there. And then the kidney doctors were involved. They did a renal biopsy. So it took a small piece of your kidney, looked at it under a microscope, sent it to the lab, and they basically found that you had lupus nephritis, so inflammation in the kidneys due to lupus. And meanwhile, the rheumatologists were called. They did all of the blood work for lupus, and they put everything together, all the lung inflammation, the kidney inflammation, the blood count problems, the joint pains, the skin rashes, and kind of diagnosed you with lupus based on all those criteria. And then they had also done an ultrasound of your heart that showed a tiny bit of fluid around the heart. So there was definitely involvement there as well. And you had some swelling or some vision problems, like little floaters or like the black spots at some point, and you had an episode where your vision was lost for a little while in one eye. So the eye doctors came and saw you, and they thought there was a lot of pressure behind the eyes in the brain around the optic nerve, and so that's something called papilledema. And so they recommended a lumbar puncture. So you had like a spinal tap where they got fluid and looked at that, and that looked okay, but basically they diagnosed you with the papilledema. And so that's just another kind of problem that you were dealing with at that time. So you were started on all the treatments for lupus, like high doses of steroids, and then you saw the rheumatologist outside of the hospital who took the treatment from there.
Wow. Dr. Jha,
that was a lot.
I was, in my previous 2 videos, I did touch on most of these points, but I forgot about, I was coughing blood.
Yeah.
And that was the night I went back to the hospital because, they discharged me for about 3 days, and I was like, oh no, like something is wrong. Yeah. I didn't feel good. Yeah. When I would lay down flat, I couldn't breathe. I remember that night was just horrible. I thought I was going to die. And we know from the facts, if I had waited, I would have died. I mean, this was bad.
You had very serious lupus, absolutely. Multiple organs involved, and fluid around the heart can build up and become like a very big problem. And same with the fluid around the lungs. There was a very tiny bit on one of the images, but that can build up into a big problem. The kidneys, can get really inflamed. So definitely you had very bad lupus at the onset, for sure.
Wow. And another thing, like, I've never talked about is for a long time I didn't think it was lupus. Like, for a long time, even after I was diagnosed and received treatment and went into remission, I was kind of like, oh, it's not lupus. It was probably the Zika. It probably caused this big problem. I was just in denial. But now that I have educated myself and I have learned more, this was lupus. I mean, this was lupus, and it was bad. So I specifically had lupus nephritis stage 3. So what does that mean exactly?
So there's 6 total stages of lupus. The first 2 stages are pretty mild, and it just has to do with what they see under the microscope. Classes 4 and 5, 3 and 4 are kind of on a spectrum. So 3 is like less than 50% of your kidney involved. 4 is like more than 50% of your kidney involved, so a little bit more severe. And then class 5 is kind of a different pattern. And class 6 means everything's so scarred over that the kidneys are kind of beyond repair. And so yours was like in the middle, meaning like it was not in the class 4 where it's like a lot of your kidney involved, but it was to a point where you have to treat because it's rather severe. It wasn't in the class 1 or 2 where the treatments don't have to be as aggressive. Yeah, so they caught it, thankfully, and were able to get you on treatment. And the repeat biopsy you had then showed class 2. So I think you had the treatment, in the nick of time, and things really got addressed in a good fashion. And it looks like you saw an infectious disease doctor after you got discharged that first time, and they picked up on the fact that you were having kind of worsening cough and the blood in the cough, and they were very worried about your chest X-ray and your nose being very bloody and discharge and that kind of stuff. And so they were the ones who wrote in their note, like, please consult rheumatology. So it's very good that doctor picked up on things and said, rheumatology needs to get involved right away, because who knows, it could have been another couple of days or weeks before rheumatology got called. So definitely props to that doctor.
Yeah, I said this in the previous video, but these doctors were amazing at Texas Children's. They were determined to find out what I had. And as you know, so many doctors were involved in trying to figure this out. I remember because when I went to the hospital the second time, they had to do all those tests, the surgery, so many blood cultures, fMRIs, MRIs, X-rays. And on my way there, I would run into so many people I didn't even know, because I was so sick. I didn't even remember who was coming in and out. And they're like, Christella, how are you? We're trying to figure it out. We're gonna have a meeting tomorrow to figure your case out. I mean, it was a lot.
Yeah.
So
pretty much every specialist was involved in your case. For sure. It was a lot for anyone to go through, and I think it took you, several weeks to months to really get a diagnosis. So I understand that you wouldn't accept the lupus diagnosis at the first glance. It takes time to accept and to make sure.
And also, I wanted to point that in my previous video, I pointed that out, because when they diagnosed me, they're like, we're so glad that we caught it where it is. I'm like, what? Like, this is horrible. Like, I almost died. Is this how you catch an illness? But now I understand, because it was, like you said, perfect timing, and it was in the middle of the storm, and they knocked that storm out. Yeah. So, wow. Okay, so now that we've tied in my illness to what lupus is and what happened to me, this is the golden question, and it's a very important question. Is lupus a treatable illness?
Yes, we definitely have good treatment options. It can take us time to kind of get the perfect results, and every patient's a little bit different. So sometimes it's a matter of going through the algorithm of different treatment options and kind of tailoring the treatment based on how aggressive people's symptoms are. But absolutely, there are treatments out there, and there's new treatments that have come out in the last couple of years. So I think things are promising.
Okay, great, y'all. So we know that lupus is treatable, and that's really important for people who have lupus and their advocacy journey to know that there is treatment for lupus.
Absolutely.
So now, the important question. So now that we know that it's treatable, how do you manage lupus from a doctor's perspective, with the patient and the doctor?
Yeah, so from our standpoint, we make sure that we are looking at your blood work really closely. We look at your blood counts, make sure there's no severe drop in the platelets or the hemoglobin, because those can be problems that require a little bit stronger treatments. We make sure your kidneys are okay, so kidney involvement can involve stronger treatments. And then other than that, we look at your symptoms, so skin involvement, joint involvement, if there's swelling in your legs, if there's hair falling out, all of those symptoms matter for us to help figure out the right treatments. And so we have kind of several categories of medications. There's the first ones like things like hydroxychloroquine, which is in the disease-modifying anti-rheumatic drugs. And so those are kind of the pill medications that we start with. So if somebody has mild lupus, we start with hydroxychloroquine. That usually helps their joint pain, skin rash get better. And every lupus patient should be on hydroxychloroquine as long as they don't have any side effects or problems from it, because it's been shown to kind of help lupus patients live longer, have less flare-ups, less problems. And it's a pretty gentle medicine that doesn't kind of severely suppress the immune system, so it's good in that regard. But then, if there's kidney involvement, we use stronger medications like things like mycophenolate, azathioprine, things like cyclophosphamide, which is like a chemotherapy medicine we use for kind of more severe cases. And then there's several other medications that have come out, like Benlysta, voclosporin. Those are kind of newer treatments for lupus nephritis, the kidney involvement. And then there's other biologics we can use if people are having problems with kind of persistent joint swelling and pain. Things like Benlysta can help a lot of patients. Safnello is one of the newer medications out there. And then other medications in that disease-modifying anti-rheumatic drugs like methotrexate, flunomide. Those medicines can help patients who have kind of persistent joint pains that haven't gotten better with just the hydroxychloroquine. So we kind of use our options and tailor it based on what symptoms patients are having and what their labs look like. And we try to slowly decrease medications over time if people are doing great, but we ramp up medications as we need to, and steroids are kind of one of the mainstays of therapy, especially early on. If somebody has aggressive disease, we often have to use higher doses of steroids and then decrease the dose over time to really get things better quicker.
Wow. So we know that doctors like you are going to work hard to give their patients the treatment that they need. But as we know, it is really important for the patient as well to take care of themselves. So what is the best way that a lupus patient can take care of themselves outside of treatment?
Agreed. Really, really important. So I would say sleep is incredibly important, getting 7 to 8 hours minimum of sleep, really listening to your body, giving it the rest that it needs, trying to make sure you have a good bedtime routine so that you kind of get the best quality of sleep as possible. And then things like diet can play a big role, so eating lots of fruits and vegetables, drinking water, making sure you're eating kind of an unprocessed diet. All these processed foods out there have a lot of additives, a lot of salt, a lot of things that we don't need, extra sugar, so it's really better to kind of eat a really clean diet, lots of fruits and vegetables, grains, beans, things that we know are kind of nourishing and give your body all the antioxidants that they need without causing problems like inflammation. We're still learning what the kind of best diet is, but it seems like things like red meat and dairy could potentially be triggers. Some patients feel better when they take those out of their diet. So, it's a little bit of figuring out what works for you, but optimizing your diet as much as possible and getting those good, healthy nutrients. Other than that, stress reduction, really working on managing anxiety, depression, kind of relaxation techniques, doing things like yoga or Tai Chi, breathing exercises, really minimizing your stress can help play a role, because people who are in high stress can have a flare-up just due to everything going on in their life. So important to manage that aspect as well. As we talked about before, sunscreen's another really important thing that patients can do, especially if they're in somewhere with lots of sun exposure, like the beach. Absolutely, you want to be wearing a big hat, sunscreen, long sleeves, protecting your skin from prolonged sun exposure. Vitamin D is a supplement that's been shown to kind of help lupus patients, so we check your vitamin D levels every now and then and make sure you're taking over-the-counter supplements.
Wow. Awesome. So now, guys, we are well equipped and on our way to greatness. I really want to hit on this point. quality of life. So how does lupus affect one's quality of life?
Yeah, so I think first thing is accepting the diagnosis and learning that it's a chronic disease. It's not like an infection where we can give a treatment like antibiotics and it goes away and never comes back. It's oftentimes an immune system problem that stays with you long term, that can flare up in times of stress, in times of illness, in times of randomness. And so it's important to know that it's there with you, but we have good treatment options, so you got to pay attention to your body and tell us if things are not going well so that we can kind of help guide you back to remission and to a low disease state. People can have a lot of joint pain, and that can lead to a lot of trouble doing daily things like getting dressed, cleaning dishes, like doing basic things that you take for granted, So it's really helpful for us to try treatments that can help calm down the joints and get things better there. Some people have really bad skin involvement, so that can affect their self-confidence, that can affect their, overall image of themselves. So, it's helpful for us to really get the skin under control too, so that people, feel like their best beautiful self. And the hair can also get involved, which, is also really troublesome. And, some patients have a lot of hair loss from it, and it can take a long time for that to come back, or it may not completely come back. So that's something all the patients have to learn to deal with and find ways to kind of get better.
Wow. So it affects everything.
Mm-hmm.
And also in some of my research, I found that some people even lose like their livelihood. They're not able to work because it has negative effects on productivity and personal development.
Mm-hmm. Right, so patients who are having a flare-up, they can have a lot of joint pain, they can have leg swelling, they can have fatigue, they can have trouble doing their job because of all of those reasons, and more. And so that can definitely lead to problems staying employed, finding a job that allows them to do what they're able to handle. And so definitely we encounter patients who are not able to keep a job for that reason, and that can be really tricky. And taking care of children can also be very hard when you're not feeling well yourself, so that can also be hard on a lot of patients.
Wow. So like the good news is that this is not the last time I'm going to talk about lupus. There's so much to talk about, so we're going to hit on a lot of health disparities in later videos. But last but not least, what are the steps that we can take in lupus prevention and finding a cure?
I think more and more research needs to be done to fully understand how we can help prevent it. I think people who have a family history should definitely pay attention to their symptoms, go to their doctor regularly, get checkups, because we know that if somebody has a family member with lupus, they're at a higher risk, so it's helpful to just watch your symptoms. Really managing your weight, managing your overall health, avoiding cigarette smoking, all of those things can potentially help. Wearing sunscreen when you're outside. And then, in terms of research, I hope that we see more and more money go into that and how to kind of better treat patients with lupus as well as how to prevent it.
Awesome. So with every guest I have, I like to kind of highlight something special about them, and I just want to say, Dr. Jha, like you are a genius, and I know you're a genius because you worked under my amazing you trained under her, right, Dr. Ramirez, who is a genius. I mean, you know that.
Great, yeah.
So you are a genius, and I never saw medicine as a talent or a craft, but it really is, especially being a rheumatologist, because when you're a rheumatologist, you see so many different patients, and as we know, these illnesses mimic other illnesses. So my illness happened to look like cancer, then it happened to look like an infectious disease, it happened to look like AIDS, and then they had to rule out everything. So you have to be very smart, and luckily Texas Children's and Baylor has the best doctors ever who are very just talented and passionate about what they do. So I just want to thank you for that, and thank you for being here to help me share my story and being a part of my second time getting in remission. And this is going to be forever. hopefully, because if I have you,
Oh.
I'm gonna be in remission forever, because I know you will not let me fall, and also I'm not gonna let myself fall.
That's right.
But
We'll do our best.
yes, so I'm just really grateful, and I hope that everyone can have a rheumatologist like you, and hopefully with educating people about lupus, we can help people find the right professionals, and talk about health disparities so that they can optimize their health and live their best lives. So, guys, that is it for this episode of Empowered Psychology. I want to thank you guys so much for tuning in and watching my podcast. I hope that this empowered the lupus survivors and warriors out there by equipping them with the knowledge they need to start to take matters into their own hands and taking control of their health. And also for those who don't have lupus and are watching this, thank you, because by you educating yourself about lupus, you have now become part of the mission to find a cure and end lupus. And again, thank you, Dr. Jha, for being an amazing rheumatologist and being here today to educate us. All my social media links will be listed down below, and I will see you guys in the next one. Bye.